Hello, I'm Dr. Alan Mercer. Over the past 35 years, I've had thousands of private conversations with men in my office about a topic most of them never expected to discuss with their doctor: erectile changes after 60. And almost every man walks into that conversation with the same assumption. They believe the problem starts in the bedroom. But after decades of practice, I can tell you that one of the biggest contributors to erectile changes often begins hours earlier, in a place most men never think to look. It begins at night, before they've even fallen asleep, in the small habits surrounding their evening routine. By the end of this video, you're going to understand why this happens, what nighttime habits may be contributing, what changes are realistic and evidence-based, and just as importantly, when it's time to have an honest conversation with your physician. I want to be very clear from the start. This video is not going to promise you a miracle fix. It's not going to tell you to stop any medication, and it's not going to shame you. My goal is simply to give you the same information I give my own patients, so you can make informed decisions about your health. Let's start with the basics, because understanding this will help everything else make sense. An erection is, at its core, a circulatory event. It depends on healthy blood flow into the penile tissue, and just as importantly, on the blood vessels themselves being flexible and responsive. When you're aroused, your body releases a molecule called nitric oxide. Nitric oxide signals the smooth muscle in your blood vessels to relax, which allows blood to flow in and create an erection. This is not a hormonal event primarily. It is a vascular event, and that distinction matters enormously because it means that erectile function is, in many ways, a window into the health of your blood vessels throughout your entire body. Here's something many men don't realize. The blood vessels involved in erectile function are quite small, only 1 to 2 millimeters in diameter. The arteries that supply your heart are larger, around 3 to 4 millimeters. Because the vessels involved in erections are smaller, they tend to show signs of vascular damage earlier than the larger arteries do. This is why some cardiologists refer to erectile changes as a potential early warning sign, sometimes appearing years before other cardiovascular symptoms become noticeable. I want to be careful here. This does not mean every man with erectile changes has heart disease. It simply means the topic is worth taking seriously and discussing with your physician rather than ignoring. Now let's talk about what happens overnight, because this is where things get interesting. Healthy men typically experience several erections during sleep, particularly during REM sleep, the deep, dream-heavy stage of the sleep cycle. Researchers believe these nighttime erections may serve a physiological purpose, helping to oxygenate and maintain the health of penile tissue. When sleep is fragmented, shallow, or repeatedly interrupted, REM sleep can be reduced, and some research suggests this may affect the frequency and quality of these nighttime erections over time. This brings me to one of the most underdiagnosed conditions I see in men over 60, sleep apnea. Sleep apnea is a condition where breathing repeatedly stops and starts throughout the night, often because the airway partially collapses. It's associated with loud snoring, gasping, and most importantly, dramatic drops in blood oxygen levels multiple times per hour. Sleep apnea has been strongly associated with erectile difficulties in multiple studies, likely through a combination of reduced oxygen delivery, disrupted REM sleep, and increased strain on the cardiovascular system. Let me tell you about a patient I'll call Robert. Robert was 72 years old when he came to see me, and he mentioned, almost as an afterthought, that his wife had started sleeping in another room because of his snoring. He also mentioned some erectile changes over the previous 2 years. I asked him about his energy levels, and he admitted he'd been exhausted for years, but had simply accepted it as a normal part of aging. I referred him for a sleep study, and it revealed moderate to severe sleep apnea, with his oxygen levels dropping significantly dozens of times each night. Once he began treatment with a CPAP machine under the guidance of a sleep specialist, his sleep quality improved substantially over the following months. I want to be honest with you, his erectile function did not simply reverse overnight, and I never promised him it would. But addressing the sleep apnea improved his energy, his blood pressure, and his overall cardiovascular risk profile, which is meaningful progress in itself. But that's only part of the story. Let's talk about what many men do in the hours before bed, because these habits matter more than most people realize. Late-night alcohol is one of the most common contributors I see. Many men believe a drink or two helps them relax and fall asleep faster, and in some cases it does shorten the time it takes to fall asleep. However, alcohol tends to fragment sleep later in the night, reducing REM sleep specifically. Alcohol is also a vasodilator in the short term, but it can interfere with the nitric oxide pathway we discussed earlier, and chronic heavy use is associated with lower testosterone levels over time. Heavy evening meals are another factor worth mentioning. Large, rich meals close to bedtime can affect sleep quality, contribute to acid reflux that disrupts rest, and over years contribute to weight gain, all of which can affect vascular health. Smoking deserves special attention here because its effects on blood vessels are well documented. Smoking damages the lining of blood vessels, called the endothelium, and directly impairs the body's ability to produce nitric oxide. This is one of the most consistent findings across decades of vascular research. Here's another reason this happens, and it's one that surprises a lot of my patients. Lack of regular physical activity. Exercise supports healthy blood vessel function, helps maintain healthy testosterone levels, improves sleep quality, and supports cardiovascular health broadly. Men who are sedentary tend to show more vascular stiffness over time, and vascular stiffness is directly relevant to erectile function. This next point is incredibly important, so I want you to really pay attention. Several chronic health conditions are strongly associated with erectile changes, and these conditions often develop silently over years. Diabetes is one of the most significant. High blood sugar over time can damage both blood vessels and the nerves involved in erectile function. High blood pressure is another, because it can damage the delicate lining of blood vessels throughout the body. High cholesterol contributes to plaque buildup in arteries, including the small vessels we discussed earlier. Obesity is associated with lower testosterone, increased inflammation, and higher rates of both diabetes and cardiovascular disease. And chronic stress raises cortisol levels, which can affect testosterone production and blood vessel function over time. Let me share a second patient story. I'll call him Frank. Frank was 68, and he came to me primarily concerned about fatigue and some erectile changes over the previous year. His blood work revealed a hemoglobin A1C consistent with poorly controlled type 2 diabetes, something he hadn't known he had. Frank told me something I'll never forget. He said, "I thought this was just what happens when you get older." I explained to him that while some changes are common with age, undiagnosed diabetes was likely a significant contributing factor in his case. We worked with an endocrinologist to bring his blood sugar under better control through medication, dietary changes, and increased activity. Over the following year, his overall vascular health markers improved considerably. I never told him his erectile function would be fully restored, because I can't promise that to any patient. But addressing the underlying diabetes was an essential step for his long-term health, regardless of that specific outcome. Now let's talk about testosterone, because I know many men wonder about this. Testosterone naturally declines gradually with age, typically around 1% per year after age 30. Low testosterone can contribute to reduced libido and may play a role in erectile function for some men, but it's rarely the sole cause. This is why I always recommend a comprehensive evaluation rather than assuming testosterone is the single answer. Blood work, a review of cardiovascular risk factors, and an honest conversation about sleep, alcohol, and lifestyle habits give a much clearer picture. Here's something else many men don't realize. Several common medications can affect erectile function as a side effect. Certain blood pressure medications, some antidepressants, and a few other medication classes have been associated with this in clinical literature. I want to be very clear about something important. If you suspect a medication may be contributing to changes you're experiencing, please do not stop taking it on your own. Speak with the prescribing physician. In many cases, there are alternative medications or dosing adjustments that can be considered, but that decision needs to be made collaboratively with your doctor, weighing the full picture of your health. Let me tell you about a third patient, a man I'll call Walter, who was 80 years old. Walter had well-managed heart disease and was on several medications, including a beta blocker. He'd been experiencing erectile changes for nearly 3 years, but hadn't mentioned it to anyone, including me, until a routine visit when I asked directly. We reviewed his full medication list together, and we discussed the possibility that one of his medications could be a contributing factor. Rather than stopping anything abruptly, I referred him back to his cardiologist to discuss whether an alternative medication might be appropriate given his specific cardiac history. They ultimately made a small adjustment together. Walter later told me he wished he'd brought it up years earlier instead of assuming nothing could be done. That's a sentiment I hear more often than you might expect, and it's part of why I'm making this video today. Why does this matter so much? Because ignoring these changes for years, rather than discussing them with a physician, means potentially missing an early signal of something like diabetes, high blood pressure, or cardiovascular disease. Many men feel embarrassed and simply avoid the topic altogether. But your physician has had this conversation many times before. It's a normal part of medicine, not something to feel ashamed of. So, what can you actually do? Let's talk about evidence-based habits that support vascular health broadly. Regular physical activity, ideally a combination of cardiovascular exercise and strength training, most days of the week. Prioritizing consistent, quality sleep, and addressing snoring or daytime fatigue with your doctor if it's present. Limiting alcohol, particularly in the hours before bed. Avoiding smoking or seeking support to quit if you currently smoke. Maintaining a healthy weight through sustainable dietary patterns rather than short-term extreme changes. Managing blood pressure, blood sugar, and cholesterol through regular checkups and, when needed, appropriate medical treatment. And finding sustainable ways to manage chronic stress, whether that's through activity, social connection, or professional support. I want to be completely honest with you. None of these habits are a guaranteed fix, and I would be doing you a disservice if I promised otherwise. What they are is evidence-based support for your overall cardiovascular and metabolic health, which is closely connected to erectile function for many men. So, when should you actually see a physician about this? If you're noticing a persistent change over several weeks or months, rather than an occasional variation, if you have risk factors like diabetes, high blood pressure, high cholesterol, or a family history of heart disease that haven't been recently evaluated, if you snore loudly, wake up gasping, or feel excessively tired during the day, if you're on medications and wondering whether they might be a contributing factor, or honestly, if this is simply on your mind and affecting your quality of life. You don't need a specific threshold of severity to bring this up. It's worth discussing with your physician regardless. Let's bring this all together. Erectile function depends heavily on healthy blood vessels and healthy blood flow. Nighttime habits like alcohol, heavy meals, smoking, and poor sleep quality, including undiagnosed sleep apnea, can all play a role. Chronic conditions like diabetes, high blood pressure, high cholesterol, and obesity are strongly associated with vascular changes that affect erectile function. Testosterone naturally declines with age and may contribute for some men, though it's rarely the whole picture. Certain medications may also play a role, and that's a conversation to have with your prescribing doctor, never a decision to make alone. And perhaps most importantly, erectile changes are sometimes one of the earliest signals of cardiovascular risk, which is exactly why they deserve attention rather than avoidance. If you found this kind of evidence-based, straightforward health education valuable, I'd encourage you to subscribe. I create these videos specifically for men who want clear, honest information without exaggeration or false promises. And if you're comfortable doing so, I'd genuinely welcome you sharing your own experiences or questions in the comments. Respectful conversations like these help other men realize they're not alone, and that these are normal, medically valid topics worth discussing openly. I'm Dr. Alan Mercer. Thank you for watching, and I'll see you in the next video.